The next form of fibromyalgia, or subtype of fibromyalgia I'd like to talk about, is hormonal fibromyalgia. So the most typical patient profile of a person with fibromyalgia is a postmenopausal woman. And why is that? Because of the hormones. Because in the postmenopausal state, the estrogen and progesterone drop. They should not go to zero, but they do drop. So that can lead to hot flashes, that can lead to temperature insensitivity, that can lead to a lot of sweating. It can lead to hair thinning or falling out. It can lead to osteopenia and osteoporosis. And it can also lead to pain. So measuring hormone levels in a postmenopausal woman and doing hormone replacement therapy is a pretty hot, controversial subject in America today. Why? In 2002, there was a large study that was published under Women's Health Initiative, and they found a correlation between hormone replacement therapy and breast and cervical cancer. So after that hit the press, primary care physicians all over the country stopped hormone replacement therapy, very abruptly, as some of my patients told me. So now it's 18 years later. What have we learned about hormones and the hormones that were being prescribed back then? Well, one very important thing to know is that these were not bioidentical hormones that were being replaced. The progesterone was synthetic progestin, which is chemically different than the bioidenticals, and the estrogen was called Premarin, which is a sort of acronym which stands for pregnant mares. So it was horse estrogen, which also is chemically quite different than human estrogen. So now we're in 2020, and somewhere along the line, this genius inventor or chemist found a way to synthesize bioidentical estrogen and bioidentical progesterone from yams. So now we're able to create the identical chemical structure of what a woman normally makes, and a man, by the way, of estrogen and progesterone. So what is now happening is that there are physicians all over the country that are prescribing bioidentical hormone replacement therapy. And I'm one of them. Dr. White in California is probably the foremost authority on hormone therapy. He's been doing it for over 30 years and has a lab in California, and he's written a couple of books on the subject. And that is part of what I read, as well as lectures by the Institute for Functional Medicine. And consequently, my fears about using hormone replacement therapy have been greatly abated by the knowledge of these experts. And in the case of Karen, who came to me with fibromyalgia that appeared to be due to her extremely low levels of estrogen and progesterone, we did bioidentical hormone replacement, and her symptoms got far, far better than they had ever been. Thank you.